require somebody to go into a hospital or cause a death in somebody. We know that there's going to be a certain number of people that have mild breakthrough cases, but so what we're really focusing on is finding those people that have those clinically severe cases that do represent breakthrough cases. And so we're getting these reported to us from local health departments across the state, and they're doing a fantastic job. It's hard work. We're also going to do some further analyses of data that we have at DSHS, just to make sure that we're really capturing all of those severe cases and deaths that are partially or fully vaccinated, so we can make sure that we are fully understanding the data with the new variants that are coming and all of the new case reports and hospitalizations and deaths that we're seeing across Texas.
A question from Maggie Glenn at KXAN. Those in the medical community who have been following the changes in the pandemic understand that recommendations and treatment options change because that's the nature of medicine and science. How can you explain to those who view the variability in recommendations as a reason to not trust what our health experts are telling us to do and convince them that the advice to get the vaccine won't change and is safe?
I think one of the things that we're trying to do is just be as transparent as we can. We know that this is a brand new virus, and it is changing as we go through this pandemic. And so here at DSHS, and I think public health workers across the country are trying to make sure that they say, you know, this data is evolving rapidly. We'll give you the best advice that we can, but any advice that I give or guidance that I give is true as of this minute on this day, and it is likely to change in the coming days to weeks to months. And so just trying to be transparent that this is an evolving situation, and that our guidance will change because we are trying our hardest to base it on science and facts and make sure that we are using the most recent, strongest data that we can to make recommendations for the people of Texas.
A couple of questions from CBS 11 News. What should school districts do to make sure kids are safe in schools? What guidance are we providing TEA on that? I know TEA is working to update their guidance to schools, and we've been in contact with them about that. But Dr. Schubert, just sort of general guidance about staying safe in schools in those kinds of settings?
So you're absolutely right. CDC has guidance about operating schools safely, and TEA is coming out with guidance, and so it's going to be fantastic to have those guidance documents. In general, we do recommend, though, that anyone who's not fully vaccinated wear a mask when they are in a public setting, so with people outside of their household. And in addition to wearing a mask, do physical distancing. And that's true for any member, any Texan who's not fully vaccinated, kind of needs to follow those same prevention steps so that we can help slow down the spread of COVID-19, and especially now that we're dealing with Delta.
Question on the vaccine side. Dr. I, I'll bring you in on this one. Jessica Shorten asks, is there a high percentage of people who have received only one dose of the 2-dose shots, and why are people not getting a second dose?
Good afternoon, Chris. Thank you so much. So the question about are there a high percentage of people who are not vaccinated with second dose? The recent data poll we have done for our state of Texas, we have around 9.5% of individuals who have received the first doses, but have not yet received they're actually overdue for their second doses. So we are really encouraging every individual to go and please get your second dose as soon as possible, even if it has been in the previously recommended guideline of 42 days. Please go ahead and get your second dose. From many vaccines are available throughout the state. So there was a second part to the question, Chris.
Well, it's just the reasons for that, if we know.
I think those reasons are pretty various. Individuals, thought that perhaps with the first dose we had some protection, but we know, as Dr. Schubert has just stated, that really important with the Delta variant to get your second dose. So we are continuing to urge, and our providers are doing a tremendous job. So if you have any questions, please reach out to your healthcare provider, your pharmacist. Reach out to us if you have any questions, but we urge and request you to complete the vaccination period.
Thank you very much. Dr. Schubert, ping back to you on this one. A couple of questions sort of about differences in what we're seeing with Delta. Ali Morris with the Dallas Morning News asks, can you talk about how this surge is different from past surges we have seen? Are younger people being hospitalized, what percentage of people hospitalized or who have died is vaccinated. And then let me fold in a question also from Ashley Lopez with KUT. Local doctors in the Central Texas area recently started raising concerns about an uptick of pregnant women being hospitalized with COVID-19. And are we seeing that statewide too?
So we are seeing COVID-19 spread quickly across Texas, and because we know that this is hitting unvaccinated population, it's really surprising the rapidity, the rise, the steep rise of cases that we're seeing in the face of 42 to 43% of our population being fully vaccinated. And so we are concerned that this is rapidly spreading through unvaccinated communities. And, you know, when we look at vaccine coverage, we see that those older age groups do have a higher vaccine coverage than the younger age groups do. So we do expect that more of these cases are going to be seen in younger individuals just because they don't have that protection from being fully vaccinated. And that some of those people are going to be in the hospital. As I've mentioned, we're seeing increased hospitalizations in every age group, including our pediatric age groups. So we're going to continue to watch that really closely. You know, here in Texas and in the United States, it's hard for us to tie our public health data to our hospitalization data because those data sets are separate. And so that's why it's useful in some places like the United Kingdom where those are tied together that we can get some good information about who's ending up in the hospital and the vaccine effectiveness against hospitalization. And so like I said, that Pfizer vaccine in the United Kingdom has been really effective at preventing hospitalizations. They showed a 96% vaccine effectiveness for that Pfizer vaccine after 2 doses to prevent hospitalization. And so we know that our vaccines can really protect against hospitalization even with the Delta variant. Just looking at fatalities, we can see that our data show that less than 2% of deaths from COVID-19 in Texas are in fully vaccinated people. And when we look at that small group of people who have died of COVID-19 after being fully vaccinated, about 95% of them are 60 and older, and over 70% of them have an underlying condition. So they've got other risk factors where maybe their immune response wasn't quite as great to that vaccine, and they're just at higher risk of disease progression because of those underlying factors. And so we do believe that being fully vaccinated really can protect people from hospitalization and death due to COVID-19, including those cases caused by Delta.
Next question from Tier McCarthy at the Fort Worth Star-Telegram. Does DSHS have any plans to financially or infrastructurally support outreach efforts like door knocking or information distribution in local communities? And that's a little bit out of you guys' wheelhouse, but I'll actually talk a little bit about that. We do, in fact, we are kind of recruiting folks now, local organizations, nonprofit groups, churches, local government groups, health allied groups and others, to apply for part of $10 million that we've set aside in federal funds to support these local groups and really these local efforts to reach out to people, educate them about vaccination, help them get to vaccination sites, whatever that looks like for those communities, for those groups. It's a partnership we're having with Texas A&M Health to administer that grant. So those organizations can go to health.tamu.edu/vaccinegrant.html to find out more about that and how they can apply for some of those grants. Those grants can range from $50,000 to $150,000 for those local groups. And really the effort is to get that money on the streets to really help the folks who are engaged in communities and a part of the communities around the state that still have people who need to be vaccinated, help them increase that education, increase that access to vaccines in whatever way is going to work within their communities. If you didn't get that web address, you can go to our news releases page. It's the most recent news release that we have there, and you can find out more information about that. So thank you. Let me scroll down a little bit here. Find the next unanswered question. We got Allie. Let me see here. Travis Bubenik with Marfa Public Radio asked, does DSHS have any plans to bring back mobile testing to rural parts of Texas, specifically in the Big Bend region where widespread testing has been basically non-existent for months now? I think there are places, testing is available in communities, but we certainly continue to work with, our partners in state government at TDEM and elsewhere to make testing available as widely as we can, and because that's still an important part of this pandemic response. We want to be able to identify people so that they are aware of their status and they know when they need to, stay away from others and stay home. So that certainly is part of the ongoing response. Another question from Kira McCarthy at the Star Telegram. The race ethnicity of almost 8% of people vaccinated is unknown, as the DSHS always required vaccine providers to record a person's race and ethnicity. If not, when was that made mandatory? Dr. Wright, can you speak to that?
Hi, Chris. Yes, thank you for the question. Actually, the exact date when we made that mandatory was February 4th, so earlier in this year. And we have seen significantly, week by week after week, that number really improve. And the 8% that's designated as others, we're actually looking into that even further to see what all constitutes in that.
I believe people can decline to specify their race or their ethnicity, and so that would be one reason that may be unknown. David Littman in Tyler asks, is the percentage of breakthrough cases changing during this new wave? That is, are vaccinated people higher or lower percentage of people testing positive or getting hospitalized sort of as we go through time?
Yeah, so that is a fantastic question and something that is a topic of active research. We know that with the variants that, like I mentioned, being fully vaccinated is really important to provide that level of protection, but that with the variants that vaccine effectiveness is impacted with some of these variants, and so we are going to watch that really closely over time. We're doing those analyses right now to see if what we saw over the entirety since we've had vaccines, say, December through now, looks different than it has just in the last 2 months, and we're actively acquiring that data and doing those analyses.
And we're running up against time here. We can hold over a little bit just so we can get to a couple more questions here. Brooke Ontiveros asks, if it is necessary to get 2 vaccine shots to be best protected, does that affect those who receive the single-dose Johnson & Johnson vaccine?
No, being fully vaccinated just means getting the vaccines that were in that particular manufacturer's series. And so for the Johnson & Johnson, that's just 1 dose. So 2 weeks after that 1 dose, you're fully vaccinated. And for people who got the Moderna or Pfizer, that means getting both doses at the recommended interval. And then 2 weeks after that 2nd dose is when you become fully vaccinated.
And Meredith Yeomans at KXAS in Dallas says appointments for COVID testing are picking back up as we would expect with more people being exposed. Can you comment on the amount of tests available? Is there a concern about having enough tests available, similar to what we saw at the beginning of the pandemic? I have not heard any of those kinds of concerns.
I have not heard any concerns either. We actually have a lot of testing supplies right now, which is different than at an earlier point in the pandemic.
And one final question before we have to go. Allie Morris has a follow-up. She asks, in the increase in pediatric hospitalizations, can Dr. Schubert address that more? What type of increase among what age groups?
Yeah.
To the extent that we know.
I know it's difficult because our hospitalization data comes in certain chunks of the population, and so the age group that we get aggregated is 0 to 17, and that's just part of the federal guidance for reporting hospitalizations to public health. And so I can tell you about that 0 to 17-year-old admissions is going up. We're seeing increases in new hospital admissions in that age group, just like we're seeing in every other age group, but it's a little hard to parse it out beyond that pediatric age range.
And finally, let's wrap it up with this. Jessica Shorten with the Montgomery County Gazette asks, or notes that there have been reports that symptoms for the Delta variant are different than traditional COVID, maybe more flu-like symptoms appearing first, aside from coughing or loss of taste and smell. Is that true? Have you heard that? And if so, does that affect when someone should go and get a COVID test?
So the symptoms are going to look very similar to every other strain of COVID-19 out there. We don't expect that there's going to be unique characteristics or symptoms about this particular strain. that will make you go get a test before it would have on any other strain. And so, you know, any different study shows a slight different combination of symptoms being predominant, but the same symptoms that are listed on our website are true for Delta variant, just like they are for any of the previous variants of COVID-19.
Thank you very much. Thanks to Dr. Schufer. Thanks to Dr. Ryan. That's all the time we have today. Thanks once again for all of you for being with us. We'll send a link to the recording this afternoon. That's usually available within an hour or so of the end of the briefing. And thanks so much for sharing this very, very important information with your readers, your listeners, your viewers. It is critical that people continue to get vaccinated because that is really the way that we are going to turn the tide on this. Where there's so much disease spreading across Texas, looking at the COVID-19 virus. So thank you once again for sharing that information with everyone out there. If any additional questions come up, of course, you can reach us at pressofficer@dshs.texas.gov. Thank you very much and have a good afternoon.